Coming up on AABJ's In Contact, October is Breast Cancer Awareness Month. The annual recognition helps to raise awareness to battle the deadly disease among women and men, and to highlight national support. We'll discuss challenges and successes in the fight. AABJ's In Contact starts now.
Be informed, you gotta know what's going on in our community. So together we can make a change, you and me. Be in contact.
Welcome to AABJ's In Contact. I'm Jada Jenkins, your host. Our show today focuses on October as Breast Cancer Awareness Month and the importance of sparking awareness for treatment and support to save lives. According to the National Breast Cancer Foundation Incorporated, 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. In 2023, an estimated 297,790 women and 2,800 men will be diagnosed with invasive breast cancer. But there is hope. When caught early, lives are saved. Dr. Jade Jones, breast medical oncologist at the Winship Cancer Institute of Emory University, is here to speak more about the battle against breast cancer in the Atlanta metro area. Welcome, Dr. Jones.
Thank you for having me. Thank you for having me today.
Thank you for being here. So can you tell us a little bit more about what we're seeing in the metro Atlanta area as far as diagnosis?
Yeah, I think the metro Atlanta area is very reflected what we're seeing nationally. You know, as you know, Atlanta has a large Black population, and so we know that in general, the breast cancer is the most common cancer in women in the world. So 1 in 8 women are going to be diagnosed with breast cancer in their lifetime. Although Black women don't have the highest incidence, we're not the most common people getting breast cancer, we do have the highest rate of mortality from breast cancer. And I think that is reflected in the population of Atlanta as well.
So why is that?
So, I mean, there's different reasons why we think that Black women have a higher mortality, and there's a lot of studies going on to try to further characterize that. We are more likely to be diagnosed at a later stage, and some of that is related to some women, Black women being a lower socioeconomic status, so being underinsured, not having primary care and primary screening such as mammograms. Also, we are more likely to have the more aggressive form of breast cancer, which is triple negative. But we find that, a recent study done by Lauren McCullough here at Emory has found that even when we are equate to our non-Hispanic white women in terms of our socioeconomic status, our insurance status, in terms of our hormone receptor positive breast cancers, we still have a higher mortality. So that means that there's more research that needs to be done to further characterize why we have this higher mortality rate.
Absolutely. And to your point about mammograms, so the saying, self-care is the best care, self-love is the best love. So what's the importance of self-checking and mammograms? Yes,
so important. So I agree with the American Cancer Society guidelines of starting breast cancer screening at age of 40. So if you're 40 and you haven't started, you should definitely have a discussion with your doctor and doing it annual every year after. If you're under 40, we don't do routine screening for most women. So I think doing self-checks, just knowing where, and you don't have to do it every day, but just knowing what your normal is, right? So as we go through our menstrual cycle, sometimes our breasts can have feel a little bit more lumpy and tender. So just know what your normal is so you can pick up when things are abnormal. Most women who are diagnosed before 40, they're going to feel their mass. And that's how they're diagnosed. So if you don't know what your normal is, you sometimes, women are like, oh, I didn't, I ignored it, or don't ignore it. There's never something you can tell a doctor, we're going to say, oh, this person is overreacting, right? It's better for you to go to the doctor, get checked out, and find out that it was nothing versus that be a cancer that was very preventable in terms of being a stage 4. So something we could have caught earlier and treated. However, there are a group of women who should be screening with mammograms before age 40, and these are our high-risk women. So how do you know if you're high risk? So one portion of high-risk women are people who have genetic mutations. So they inherited something from their mom or dad. A most common gene is the BRCA mutation that is going to increase their risk of breast cancer up to 60-80%. And those women should actually start screening at age 25, right? So have conversations with your loved ones, with your family members. Hey, did anyone have cancer, and who had cancer, and what age they had cancer? And if any of those light bulbs go off, have the conversation with your doctor. However, there are other women who may not have a genetic mutation that we know of, or have a family member that had a genetic mutation that are high risk. And that's a discussion to have with your doctor about, hey, do you think I'm high risk? And she can go over the risk, he or she can go over the risk factors and determine if you need to start screening earlier. But it's not something that is just common knowledge. So it's just, if even the thought comes across, have the discussion with your doctor.
Absolutely. And I love the fact that you said these are the questions that you need to ask your doctor. You spoke briefly on family history. So is there a certain side of the family, a maternal, paternal side of the family that we should be more worried about? Or should we just be worried in general? If breast cancer runs in your family, you should definitely make sure you're getting checked.
It doesn't, even if you're not sure, talk about it with your doctor. And it actually starts with you talking about it with your parents and your grandparents and your aunt. So one big trigger is anyone, even if it's just one person that has had breast cancer, ovarian cancer, pancreatic cancer, or prostate cancer before the age of 50. If anyone has had that, then you should get genetic testing. Another thing is if you had multiple people, often we say like 3 people in your family, and often we're talking about not just siblings, but your parents, their siblings have had, more than, or grandparents, multiple people have had any of those cancers. That's when we were concerned that you should get genetic testing. But if you're just not sure, like, oh, I think someone had cancer and I think this other person, have the conversation with your doctor, and they can, they know guidance a little bit better, and they can tweeze it out. So, it's never harm to ask those questions.
Absolutely. So, doctor, where are we now in terms of treatment?
So in terms of treatment, so it's a very broad question, but so there's 3 different types of breast cancer. There's hormone receptor positive, that's driven by the estrogen and progesterone that we make. There's another one called HER2 positive, that's driven by a protein that we all make. And then there's triple negative, and that just means you don't have the first 2. And so we have a lot of advances in breast cancer. Since 1990, the overall survival rates have improved overall, but we can do better, right? And so I would say that a lot of new treatments, but the treatment is really going to be based on the type of breast cancer. So based on the type means you'll get different therapies than somebody else who has the same stage as you.
So what's something that you wish people knew about the different types of breast cancer? Because I don't believe general population know. I think everyone kind of just groups it together. Breast cancer is breast cancer.
Yeah, so I think I think less about because when you're diagnosed, it is a shock of your life, right? Nobody wants breast cancer. My mom had breast cancer. I remember her saying, I just became a part of a club that I didn't want to be in, right? So I would actually say the most important thing is when you've been diagnosed, bring a friend or a family member to that visit with you, because there's going to be so much information given to you about your type, what we want to do for treatment, that you're maybe so in shock it's hard to take it all in. And the support of from a friend or a family member, often them writing down, them able to just be there is very helpful. So you don't have to do this battle alone. So I think that would be very important is, sometimes, especially in minorities community, they keep it close. I don't want to stress my children. I don't want to tell my husband and those people want to help you more than you know.
Absolutely. You definitely need some type of community. This is not something that you're just going through on your own. And this is also not something that, you're not the first person that has been exposed to this. And so that's also, why we wear pink in color of solidarity and unity. And so what kind of studies are being done at Emory at the moment?
Yeah, so, we always, standard of care is what you can get across the nation. And I definitely think we're really good at providing standard of care. But we also have clinical trials. And clinical trials are where, and it doesn't even have to be a drug, but sometimes they're drugs. We're using new drugs to see if they're working effective for this type of breast cancer. But some of these studies are studies where it's not drug related, and we're just trying to improve quality of life and other things to help understand the disease better and help women women and support them and men.
That's the most important. Yeah. And we are talking with Dr. Jade Jones with the Winship Cancer Institute. We have to go to a short break. We'll be right back in a moment.
Got a new house.
I think I finally found a place that I call home. There is a road laid out for me.
First night here, but Amy seems cool.
Leading down to the river. I am blind, but I need not see.
What do you think?
I know this road is there for me. If I'm really free, take me down to the river and walk.
Hey, honey. We thought we'd try something new.
Family art hour. What do you think?
You got jokes. You're funny.
Learn about adopting a teen from foster care. You can't imagine the reward. Learn more at adoptuskids.org.
Good morning. Can I ask you one question? I'm with the Prevent Cancer Foundation.
I did not know that.
I didn't know that.
Well, I didn't realize it was quite that high. No. By changing our lifestyle, we could prevent a lot.
Lifestyle and knowing your family history to allow adequate time for screening and making sure you get screened by certain ages is very important in ensuring that cancer gets prevented in you.
I do not. Not really. I don't think so.
A lot of people don't know about their family history, and they don't know until it's too late.
There are very many conditions that can be ruled in or ruled out based on your family history.
Don't smoke. Don't drink. Go get your mammograms.
Check early, check often.
There was an old woman who lived in a shoe. She had so many children. She didn't know what to do.
Did you have a good day at school?
She gave them some broth without any bread.
There you go.
And kissed them all soundly
Night night.
Good night. And put them to bed. Hunger is a story we can end. End it at feedingamerica.org.
Welcome back to AABJ's Public Affairs Program, In Contact. For those of you who just joined, today our topic is Breast Cancer Awareness Month, a time to help pull in support and spark awareness to save lives. Dr. Jade Jones with the Winship Cancer Institute at Emory University, thanks again for being with us.
Thank you for having me.
And so I want us to talk about the common misconceptions that we have when it comes to breast cancer, including men can also get breast cancer. Can you elaborate a little bit on that?
Yeah, so breast cancer is not only a cancer of women, it can also affect men, even though at a lesser rate. The biggest risk factor for men is actually the genetic mutation that we were talking about. Men who are carriers of BRCA1 or BRCA2, often they don't know that because they were never tested, and maybe the family members haven't shared information. I think a good example is, Beyonce's father. He had breast cancer, and now he's a big component advocate, and he also expressed that he had a family history that, just he'd never really thought about it. I think, I have male patients, a lot of times they're coming with their cancer more advanced because they start having some of the symptoms and they ignore them because they never even think, oh, this could be cancer. So it's very important. For men, we don't do routine screening, so we don't do mammograms and we don't do any other routine tests. But a lot of times breast cancer can present as a mass on the chest wall. So if you feel something new that wasn't there before, sometimes it can present as just a rash. So if you have, and this goes for women too. So it can present as just redness, rash on the breast, or for men, a chest wall. If it gets more advanced, I had a patient who came in with swelling on his arm and, over a year period, right? So don't ignore those things. Go see your doctor because if it's nothing, great. But if it is cancer, hopefully we can catch it earlier and prevent it from being a non-curable cancer.
Absolutely. So if you have even the slightest idea of what is going on, me personally, I Google everything, and Google is telling me, Jada, you might want to see a doctor. And where do I go?
Yes.
Straight to you. So absolutely. And so as we're talking about common misconceptions and different types of communities, can we also talk about the African American community specifically and how breast cancer is affecting those in that community?
Yeah, so like I said, we don't have the highest incidence, but we do have the highest rate of mortality. And one of the big things is that we come at a later stage. So we're not, some of us are not getting our screening, our mammograms, and how important that is. Breast cancer is one of the few cancers where we can actually screen and we can catch the cancer early. And as I said, you start your mammograms at 40. And it's so heartbreaking when you have a patient come in and they're stage 4 non-curable and they never got a mammogram. And even during the COVID pandemic, I've had patients come in, they were getting screening up into 2020 and they just, 2021, 22, they didn't get any screening and they're coming in 2023 with more advanced cancer. So it's so important to get your mammograms. The other thing is, yes, for the most part, you have to have insurance, but there are a lot of foundations that are providing mammograms for free. And it just takes a little bit extra work. So Sisters by Choice is a foundation, nonprofit foundation here in Atlanta, and they do free mammograms. So it just kind of takes a little bit, through Google and other resources for you to get your mammogram. So that should never be a barrier. Lack of insurance should never be a barrier why you didn't get a mammogram.
Absolutely, and we're talking about Google and different resources. I read an article about AI actually being a resource. Can you speak briefly about that?
Yeah, artificial intelligence. I would say that is not something we commonly are using right now, but but it's something we're moving towards. So breast cancer, most common cancer in the world, radiologists are normally the ones who are reading these mammograms. But a lot of places, even within the United States, have rural areas and may have limited resource to the people reading mammograms. And so there are companies building device AI systems that can read mammograms and ultrasounds so that we're not limited by resources of specialists needing to read those, and hopefully can increase our rate of detection as well.
So would you say that this is something that you will tell the general population, there's no worry, we're still working on our technology and making sure that everyone, no matter where you are, you're all covered? Yeah,
exactly. And I would say right now mammograms are accessible within our primary care, within our OB/GYN offices, and a lot of foundations can give you resources on where you can get mammograms for free. And even there are the health department. So the health department provides care for people without insurance, and they can give resources, and this is here in the state of Georgia, on where mammograms are being done for free. So it should never be, lack of insurance should never be a reason why we're not screening.
Absolutely. It's time now to take another short break, and when we come back, we'll discuss events and walks taking place around town this month to support breast cancer awareness. Back in a moment.
All right, let's try this. COVID has been a really long fight, and it's been especially tough on kids.
It's been a rough transition for all of us.
Right now, as a father, I want to give the best tools to protect my kids.
So what can we do to get back to that sense of normalcy?
Many parents are asking if it is worth it to get their kids vaccinated against COVID.
The answer is absolutely yes.
My own sons, who are 6 and 8 years old, had their COVID vaccine.
It's an added layer of protection to keep kids from getting any type of severe illness or complications from a COVID infection.
A lot of parents are also wondering if the vaccines are safe. Yes, it's safe and effective for children.
Definitely safer than a COVID infection.
Children get a smaller dosage than adults do.
So if you have questions or concerns about the vaccine, that's okay.
We're here to help.
We have the tools we need to protect kids and help them stay healthy and all get through this together.
My baby's back from the West Coast.
Here are those pictures that you asked for your school project? First day of school, cute as a button.
So long ago.
Oh, here's Grandma Florence after that flood wiped out the whole neighborhood.
Sometimes I just cannot believe all the storms we've gone through here.
I can only hope that we'll be able to leave this house to you one day, baby. You're our legacy.
Planning for these disasters will make sure we're safe, and is the best way to protect that legacy.
Those beans smell heavenly.
Give Mom a little credit.
You know what? We should make an emergency communication plan. That way we're ready this year.
Oh,
Great idea.
At my dorm, we have emergency kits for earthquakes and wildfires, but I'm sure there's something more local I can send you with the link.
Okay.
Smart.
I'm coming to share with you guys.
Protect your legacy. Plan for natural disasters today. Visit ready.gov/plan.
When I was in foster care, I never knew when I would have to move. So I always had my suitcase ready to go. Then one day I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
Welcome back to the show. On October 21st at Lenox Square, the Susan G. Komen Pink Walk got underway to help raise critical funds for breast cancer patient care services, including financial assistance programs. This event is one of the many around the Atlanta metro area and across the nation to help battle breast cancer. Dr. Jones, the overwhelming support from Susan G. Komen Emory's Winship Cancer Institute, and many other organizations are truly making a difference. What's your reaction to all of this overwhelming support?
I think it's great. I think, people always wonder where their dollars go. So today we actually had a walk for Emory, the Winship 5K, where we raise money for all cancers. And that money goes into supporting researchers and creating new studies and new trials where we can hopefully impact care and improve our clinical outcomes. So, when a lot of times it's good for our ability to push the field forward from a research standpoint, it also allows families to bond with the patient that there's undergoing the cancer, whether that be your mom or your dad, and allow them to show support for those people during the time that they're in the crisis really of their life. So these support systems are so important, and so it may just seem like, another 5K or another walk, but these things are also a time for breast cancer active patients and survivors to bond, to meet other breast cancer patients, men who have breast cancer meet other men. So I think these organizations, including Emory, and what we're doing allows a lot of time for our improving outcome and also improving our overall patient care.
Absolutely, and you kept saying the word bond, and bond in my mind means community and unity and family and friendship and relationships and all of these different things, especially when it comes to a walk. You can do a walk from as little as 2 years old to 92 years old. And so let's talk more about this feeling of community and how can we support those in our lives who do have breast cancer?
Yeah, so breast cancer is a team sport. I always say that. I played basketball in college. So even let's talk about just on the clinical side. So in order for me to care for breast cancer, especially early stage, there has to be a surgeon involved. They have to have surgery, often radiation oncologists, the emotional things that patient goes through. So we're preferring patients to often specialized psychologists who deal with patients with cancer. We have social worker. You know, if I'm getting my treatments, I might not be able to make work as often, right? But I need to be able to still put food on my table. So a lot of times we're applying for grants for these organizations for these patients to keep their lights on and get the things they need. So on the clinical standpoint, we're a big team. On the patient standpoint, you know, cancer can be very isolating. You're the one undergoing cancer. So I talked earlier about the importance of, you know, being a family member. It's a private thing for patients, but being at least somebody you're close to so they can be, you know, people want to help. They want to support you. You may not feel well on the day that you have chemotherapy, and you may need somebody else to drive you. So, you know, I think there's the physical, let's kill the cancer cells, but there's also the emotional and the psychological portion of breast cancer that cannot be neglected.
Absolutely. And at this moment, we're talking about how to support those who have cancer. But how do we then support each other as we're supporting that person? You know, let's say your auntie has breast cancer and you're pouring into her anything she needs, you know, you're always her biggest cheerleader. How do you then take care of yourself?
Yeah, so they're caregiver support groups. So there are support groups just for people who are caregivers or people who are chronically ill or who have cancer. So, you know, a lot of times you may not know the resource, but the doctor that's taking care of the family member may need resources for caregiver support groups. So this is why I think it's important, like as a community, we have to come together, and organizations like Susan Komen and Emory and other American Cancer Society, Sisters by Choice that we talked about earlier, are all doing a really group to make sure that we're educating our community, but we're supporting these patients and their loved ones as well.
Support community testing is the biggest theme of today's conversation with you. And I just want to stress again how important it really is to be there for each other, and most importantly, be there for yourself and make sure you get tested. Thanks so much, Dr. Jay Jones, breast medical oncologist at the Winship Cancer Institute of Emory University. And thanks to you, our viewers and supporters, for watching today. That's our show for now. Please stay in contact to stay informed. Have a great day, and we'll see you next time.